Good day everyone, I am Beconia from BSN3E and today I will going to discuss about arteriosclerosis and atherosclerosis. So the contents are as follows. We have the definition, introduction, prevalence or incidence, clinical signs and symptoms, laboratory and diagnostic examination. Concept map of pathophysiology, medical or surgical management, nursing management, and lastly the prognosis. So let's come up now to the definition of arteriosclerosis and atherosclerosis. So when we see arteriosclerosis, this is the hardening of the arteries and the most common disease of the arteries. It is a diffuse process whereby the muscle fibers and the endothelial lining of the walls of small arteries and the arterioles become thickened. While atherosclerosis, this is a specific type of arteriosclerosis, the buildup of fats, cholesterol, and other substances in and on the artery walls. This is build-up is called plaque. The plaque can cause arteries to narrow, blocking blood flow. The cardiovascular system comprising the heart and blood vessels. It plays a critical role in maintaining the body's essential functions by ensuring the efficient circulation of blood. Arteriosclerosis and atherosclerosis are two interrelated conditions that affect the arteries, the vital conduits through which oxygen and nutrients are transported to tissues and organs. Arteriosclerosis. So, it is a broad term encompassing changes in the arterial walls that result the thickening and hardening. As individuals age, arteries naturally undergo alterations, becoming less elastic and more rigid. While atherosclerosis, it is a subtype of arteriosclerosis that involves buildup of plaques with the arteries. These plaques consist of cholesterol, fatty deposits, cellular debris, and calcium. The prevalence of atherosclerosis varies depending on various factors such as age, sex, lifestyle, and underlying health conditions. In people aged 40 to 59 years old, the prevalence of atherosclerosis is around 46%. This increased to around 69% in individuals aged 60 to 79 years old. It further rises to 85% and those aged 80 years or older. When it comes to sex, studies have shown that men tend to have a higher prevalence of atherosclerosis compared to women. However, the risk of atherosclerosis increase significantly in women after menopausal, so they may catch up to surpass men in terms of prevalence. So the laboratory and diagnostic exam, we have angiography. Angiography, it is a test that uses dye and special x-rays to show the insides of the arteries and can reveal whether plaque is blocking the arteries and how severe the plaque is. A thin flexible tube called catheter is put into blood vessels in the arm and groin, upper thigh or neck, and a dye that can be seen on x-ray is then injected into the arteries, and by looking into the x-ray picture, a doctor can see flow of blood through the arteries. Next, we have blood test. Blood test check the levels of certain fats, cholesterol, sugar, and proteins in your blood, and abnormal levels may indicate risk factors for atherosclerosis. And next, we have also computed tomography scan. Computed tomography or CT scan creates computer-generated images of the heart, brain, and other areas of the body. The test can often show hardening and narrowing of large arteries. Next is chest X-ray. A chest X-ray takes a picture of the organs and structures inside the chest, including the heart, lungs, and blood vessels. Next, ankle or brachial index. This test compares the blood pressure in your ankle with the blood pressure in your arm to see how well your blood is flowing. Next is we have EKG or electrocardiogram. An EKG is a simple test that detects and records the electrical activity of the heart and shows how fast the heart is beating and whether it has a regular rhythm. It also shows the strength and timing of electrical signals as they pass through each part of the heart. Certain electrical patterns that the EKG detects can suggest whether CED is likely, and an EKG, also known, shows signs of previous or current heart attack. So next we have stress testing. During stress testing, exercise is used to make the heart work hard and beat fast while heart tests are performed. So the pathophysiology of atherosclerosis, we have non-modifiable factors such as age, genetics or family history of atherosclerosis, gender, and ethnicity. So age is one of the factors because it is more common as people age. The risk of developing atherosclerosis increases with advancing age. And genetics or family history. A family history of cardiovascular, including atherosclerosis, can increase individuals' risk, and genetics factor may influence cholesterol levels, blood pressure, and other cardiovascular risk factors. While gender, men tend to have a higher risk of developing atherosclerosis, and the risk increases in women after menopause. Ethnicity, also one of the non-modifiable factors because certain ethnic groups may have a higher predisposition to atherosclerosis and related cardiovascular conditions. For example, individuals of South Asian descent may have an increased risk. And the modifiable factors of atherosclerosis, we have high LDL cholesterol. So high LDL cholesterol, elevated levels of LDL cholesterol increase the risk of atherosclerosis. And stress, chronic stress may contribute to development and progression of atherosclerosis. Also, physical inactivity. Lack of regular physical activity is a significant risk for atherosclerosis. Last is smoking. Tobacco smoke contains harmful chemicals that can damage to the endothelial lining of arteries, promoting inflammation and development of atherosclerotic plaques. So this will result in endothelial dysfunction. Atherosclerosis typically begins with damage to the endothelium, the inner lining of the arteries, and it will cause inflammatory response. In response to endothelial injury, the body's immune system is activated, leading to an inflammatory response. White blood cells, particularly monocytes, adhere to the damage of endothelium and migrate into the arterial walls, and it continues to formation of fatty streaks. Lipids, particularly low-density lipoprotein, cholesterol, penetrate the damaged endothelium and accumulate in the arterial walls. This process leads to the formation of fatty streaks, which are the earliest visible lesions of atherosclerosis. And then the formation of atherosclerotic plaques, continued inflammation, and the accumulation of lipids lead to the development of atherosclerotic plaques. This plaque consists of a lipid core, smooth muscles, collagen, and other cellular components. Then it will result to fibrous cap formation. As the plaque matures, a fibrous cap may form over the lipid core. The stability of this cap is crucial. A vulnerable plaque may rupture, exposing its contents to the bloodstream. Then, cardiovascular thrombosis and occlusions. Ruptured plaques can trigger the formation of blood clots or thrombosis. If a blood clot obstructs a coronary cerebral artery, it can lead to be heart attack or stroke. So here are clinical signs and symptoms associated with arteriosclerosis and atherosclerosis. First is angina. Atherosclerosis can lead to chest pain or discomfort known as angina. So this pain is often described as tightness, pressure, squeezing, or burning sensation in the chest. Next is shortness of breath. Atherosclerosis affecting the coronary arteries can result in decreased oxygen supply to the heart muscle, leading to shortness of breath and especially during physical exertion. Fatigue. Insufficient blood flow to the heart or other organs may cause fatigue and weakness. Next is leg pain. Atherosclerosis in the arteries supplying the legs can cause pain, cramping, or weakness during physical activity, a condition known as claudication. Next, numbness or weakness. Because of reduced and blood flow to the brain due to atherosclerosis in the carotid arteries can lead to symptoms such as numbness, weakness, or difficulty speaking depending on the area of the brain affected. This may precede a stroke. Next is impotence. Atherosclerosis affecting the arteries supplying the genital organs can contribute to erectile dysfunction in men. Next is cold extremities. This is due to reduced blood flow to the limbs, can cause coldness in the hands and feet. And high blood pressure, atherosclerosis also can contribute to the development exacerbation of hypertension. Last is cognitive impairment. Atherosclerosis in the cerebral arteries may contribute to cognitive decline, memory loss, or difficulties in concentrating. So here are some common medical and surgical interventions associated with atherosclerosis, a specific type of arteriosclerosis. So medical interventions, we have the medications, statins. These medications are commonly prescribed to lower cholesterol levels and reduce the progression of atherosclerosis. While antiplatelet agents, medications such as aspirin or clopidogrel may be prescribed to reduce risk of blood clots, and antihypertensive medications such controlling blood pressure is essential, and various classes of medications may be used. Lifestyle modifications, dietary changes, adopting a heart-healthy diet that is low in saturated and trans fat. Physical activity, engaging in regular exercise to improve cardiovascular fitness. Smoking cessation, quitting smoking is a crucial to reduce cardiovascular risk. And next is interventional procedure. So we have angioplasty and stenting. In cases where there are significant blockages in the arteries, a procedure called angioplasty may be performed. This involves inflating balloon in the narrowed artery to widen it, and the stent may be placed to keep the artery open. We have also atherectomy. Atherectomy, it involves removing plaque from the arterial walls using specialized catheters or devices. Next is surgical interventions. So, first one is coronary artery bypass grafting or CABG. CABG is a surgical procedure in which healthy blood vessels is taken from another part of the body and used to bypass blocked or narrowed coronary artery, restoring blood flow to the heart. Next is carotid endarterectomy. This surgical procedure involves removing plaque from the carotid artery to reduce the risk of stroke. It is important to note that the choice of interventions depends on the severity and location of arterial blockages, the presence of symptoms on the individual's overall health. The prognosis of atherosclerosis. Atherosclerosis cannot be reversed once it has occurred. However, lifestyle changes and treating high cholesterol levels can prevent or slow the process from becoming worse. This can help reduce the chances of having a heart attack and stroke as a result of atherosclerosis.